What are diabetic blisters? Diabetic blisters occur as one of the many possible complications from diabetes. There are various types of blisters that can occur with people who have diabetes. Common types are friction blisters, bullosis, diabeticorum blisters, and blisters that appear following a fungal infection. In many cases, the patient may not even be aware that blisters have appeared, particularly if there is nerve damage. One of the biggest issues that diabetes presents is that it has the potential to cause so many complications. While the main problem is managing blood glucose, the disease can wreak long-term havoc on the body. Diabetes can cause cardiovascular disease, brain issues, cancer, and nerve damage. The nerve damage is one problem that can lead to developing blisters. Friction-caused diabetic blisters are commonly found on diabetics who suffer from nerve damage. Neuropathy reduces the threshold of pain and discomfort. This means that a diabetic with neuropathy may not be able to feel a burning sensation or pain when the skin rubs too fast or hard against something. Diabetics with neuropathy often notice blisters appearing regularly on the feet. In many cases, poor circulation and swelling cause shoes to rub on areas of the feet. Bullosis diabeticorum is a disease that coincides with diabetes. It causes diabetic blisters that are not accompanied by inflammation. These blisters spontaneously appear and can be found all over the body. Doctors closely monitor patients with this disease because secondary infections can occur easily. Secondary infections are often the result of a broken blister becoming exposed to a bacteria and the area becoming infected. Candida albicans is a fungus that causes infection. It is one of the common fungi that affect people with diabetes. The diabetic blisters that stem from this infection are usually surrounded by an itchy rash. These blisters can be found in moist and warm folds of the skin, such as in between the toes and in armpit. The fungus gets into the skin and thrives from the warmth and moisture, eventually causing the blisters to appear. Continuous, regular medical care is necessary for patients who develop diabetic blisters. Friction blisters and bullosis diabeticorum blisters do not generally require medications for treatment unless a secondary infection develops. With fungal infections that cause blisters, however, an antifungal medication is necessary to get rid of the fungus. For people who suffer from nerve damage, proper diabetic foot care can prevent foot blisters.